Hello, hi, it's Dr. Erica. Thank you for joining me on today's topic. I'm going to talk about briefly glaucoma. This is a part of the eye, ears, nose, and throat series that I began. And the first topic of this series is going to be glaucoma. There are several types of glaucoma, primary and secondary. Primary is mainly due to a normal change in ocular pressure and change in the cornea or change in the anatomy of the eye. Then the secondary is primarily going to be due to trauma, injury, surgery, medication use that has caused a change in the eye. Okay. Also, it could be secondary, could also be due to ocular inflammation or inflammation of a part of the anatomy of the eye, and pigmentary changes as well. Um, the main type of glaucoma is going to be the open angle glaucoma, or ocular hypertension is what it's also called, which occurs more so or more prevalent than the narrow angle glaucoma or closed glaucoma. Now, the goal of treatment usually is to decrease the intraocular pressure of the eye, and that's usually done by topical medications that can be applied to the eye. If there's multiple eye drops that are to be used, it's recommended by the American Academy of Ophthalmology to use eye drops 5 to 10 minutes apart, and also to be very consistent and adherent with the application of medications to increase efficacy and also the outcome of better vision and so forth. Now, 60 to 80% of patients over a 5-year period will experience, with well tolerated, controlled treatment, will experience an improvement in their vision and so forth. Also, the earlier the detection and the earlier the treatment of glaucoma, the better outcome. And the key to the treatment is, again, adherence or compliance, making sure that eye drops are topically applied as instructed. And then also, sometimes the doctor may give a prescription for oral ingestion instead of topically. So that is to take note as well. Now, the progression of primary open angle glaucoma is slow progression. There's usually a vision loss, and there may be asymptomatic experience or characteristics, and it's chronic, usually in state, and it occurs usually in patients who are 50 years of age and older. So, glaucoma, intraocular pressure in open angle glaucoma will usually be elevated, or it could be normal. If it's normal and the patient is still experiencing those symptoms of vision change, vision loss, they still can be diagnosed with glaucoma. Okay. Now, the closed angle glaucoma has acute symptomatic, and it occurs usually in East Indian, Chinese, and Asian descendants. The intraocular pressure is usually elevated in those particular populations. And again, they may experience the blurred vision. They may also experience headaches, pain, discomfort, and also vomiting and nausea sensation as well. So that is the difference between the closed angle glaucoma and the open angle glaucoma primary. And again, the secondary open angle glaucoma is usually presented after a surgery or trauma or ocular inflammation. Also, do take note there are guidelines that physicians will follow when treating glaucoma. So do be aware that there is an algorithm that they do follow. And there are some medications that I'm going to go over later in this video that talk about that are medications that I will talk about that will let you know that they may cause glaucoma if you're taking these medications or know someone who may be as well. Pharmacists are always on the lookout for medications that interact, medications that may hinder or cause an adverse effect from the glaucoma medications that you may be taking topically or consuming. So we, as pharmacists, we do clinical review, and we also do a thorough evaluation of medications before we give medications through the dispensing system. And we also keep in contact with nurses and physicians to let them know that we have actually found this type of interaction and we want to go forward with an alternative, or we want to go forward with discontinuing a particular medication to make sure that other medications are not adversely working against the glaucoma medications. Okay, so if you are a patient who is taking medications, I'll go through the list here, and they can be any of these medications are potentially causing increased intraocular pressure, therefore causing a risk of glaucoma. And that could include medications such as ophthalmic anticholinergic medications, vasodilators, also medications such as the ipratropium, the antihistamine class of medications, as well as antidepressants, anti-seizure medications. Those can include the venlafaxine and the topiramate. Also antibiotic therapy like tetracyclines as well. And also medications that, again, antidepressants, anticholinergics, medications that interact with muscles, usually because the eye does have a muscle that helps to help with visualization. And so medications that act on the other muscles in the body may also act on muscles in the eye. So do be aware of the medications that I've listed. Okay, now medications that are used to treat glaucoma can be topical or they can be in pill form. Usually, first line choice of medications, doctors will choose prostaglandins. Prostaglandins may include medications like your Travatan medication. They might choose beta blockers as well, maybe first line, and that can be like your Timolol or your Tamoptic ophthalmic solution. They might choose one of those two, or they may choose both. And again, if you're going to take multiple eye drops, it's best to use them 5 to 10 minutes apart for best effect. And then you're going to keep the eye closed. You can apply pressure to the inner portion of the eye while the eye is closed. Hold your head back. Let that solution enter into the, get back into where it needs to be in the eye so that medications do not exit the eye and then the effect is not rendered. Using multiple drops of eye drops at a time does not increase the effects, but actually cause adverse effects. So do be aware of that. If the instructions call for 1 drop or 2 drops at a time, then don't go over that amount because you don't want the adverse effect from the medication. Again, you're going to apply the eye drop into the eye, hold the inner eye, close that duct. There's a duct there, a tear duct right there. You're going to close that duct, close that eye for about a few seconds. Let that medication get to where it needs to be, and then you open your eye and can release that tear duct. Okay, so that's what that's why I applied that pressure right there. There's a duct there, and so the medication will run out and leave the eye and will not be in the eye as expected. Okay, and then after about 2 to 4 weeks, of the first medication or first combination of medications, after 2 to 4 weeks, the doctor will call the patient back into the ophthalmic office to get reevaluated, intraocular pressure reevaluated. Once it's reevaluated, they can go forward with continuing the regimen, or they can make alternatives. If there's a contraindication, they may take the patient completely off of that and put them on something that's a whole lot tolerable. And then after about 2 to 4 weeks, if there's no response, hopefully there is a better response, but if there's not, then there's medications classes that are further initiated, like the carbonic and hydrase inhibitors. That particular class is topical, and then also there are oral medications as well that can be given. Okay, and then after another 2 to 4 weeks, the patient is reevaluated again. If no response, then the patient may be eligible for a surgery or laser intervention at that point, just depending on the situation. So that's a general overview of the guideline and how the doctor will follow through with the medication list, and then also proceed with non-pharmacological therapy, which will include surgery, laser surgery as well. So I have had the pleasure of dispensing medications for glaucoma, and I have not had a lot of people to actually come through with questions or demonstrations on how best to insert the eye drop. So it seems like patients are understanding and being more adherent. I don't see a lot of patients usually who come through and say, well, I don't want to take the eye drop. I'm not going to fill the prescription. Usually patients are very compliant, and that is the most effective way to get through glaucoma symptoms and better vision, adherence and compliance. Okay, so if there's any questions about or comments, please let them leave them in the comments section. Again, I am Dr. Erica, pharmacist for close to 10 years, and this is my platform. Please visit my website as well. It's in the description section, and please leave any comments that you may have. Now, before I leave, I just want to make sure that I'm not leaving out any pertinent information, and I want to make sure that I'm giving out all information. Now, if there is need for eye drops such as a lubricant or red relieving eye drops, those can be picked up over the counter with your prescription medication for glaucoma. Now, that may include Systane brand. Systane brand is a good brand that helps with lubrication of the eye, and that can be applied about 5 to 10 minutes after applying glaucoma eye drops. That will help keep the eyes moist and non-dry as well. And then there's redness relievers that have an active ingredient in them as well that I can recommend. And also, glaucoma is anti-glaucoma medications are not cures for glaucoma, but they do relieve the symptoms, mainly the intraocular pressure increase, and then also they help with increase in vision because the intraocular pressure will come down. Once that comes down, the vision will get better. The lighting of the halo will disappear. The other symptoms that you may be feeling, nausea, vomiting, headache, all of those will get better over time. Usually over a 5-year period, patients again will feel that long-term effect. Okay, and if there's other eye drops to be used, such as antibiotics, the doctor will, the pharmacist, the doctor of pharmacy will let you know and how to administer apart from your glaucoma medications. And there are some eye drops that come in combination so that you don't have to use so many different eye drops to treat glaucoma. Like, for example, There's a bottle of COSOP, which includes a beta blocker and then also another medication. When those two medications are in one bottle, then that helps to reduce the number of medications that you may have to keep up with in your medicine cabinet. Also, the amount of drops you have to put in your eye. So do be on the know about that. Okay, when administering eye drops, it's best for a large percentage of patients, to use topical ophthalmic drugs. Patients should be taught the following: wash and dry hands. Shake the bottle if it contains a suspension. Shaking the bottle will help to mix the suspension, mix it thoroughly so there's no particles that are left in the lower part of the bottle. With the forefinger, pull down the outer portion of the lower eyelid to form a pocket to receive the drop. Grasp the dropper bottle between the thumb and fingers with a hand braced against the cheek or nose and the head held upward. Okay. Place the dropper over the eye while looking at the tip of the bottle. Then look up and place a single drop into the eye. The lid should be closed but not squeezed or rubbed for about 1 to 3 minutes after installation. Okay, so that's a change in what I said previously. So once the eye drop is placed into the eye pocket, the eye should be closed for another 1 to 3 minutes. This increases the ocular availability of the drug. Now, also to go further, like I mentioned before, the index finger, while the eye is still closed, can be pressed right in the corner on that tear duct to keep the medication inside the eye for better availability. Once that is done for about a minute or to 3 minutes, then the eye can be reopened. Okay, recap the bottle and store it as instructed into your medicine cabinet. Recapping the tip of the bottle helps secure sterility and prevents cross-contamination. So that's why it's very important to keep hands and personal hygiene very clean with these bottles. And they can't be kept at room temperature, away from pets, children, and also those of special needs, so that these medications are not ingested or used improperly. Now, these medications are not very harmful, but they may be harmful to patients who are not do not have glaucoma. So do be aware of the presence of others around these medications. And I'm Dr. Erica. I thank you for joining me on this video, and I hope to see you on the next video. Thank you.